Dr. Bugtay was inspired to start this research institute after his visiting professor's stint at the University of Pisa as part of the AsiaLink program funded by the European Union, developing competencies in biomedical engineering. Opportunities to collaborate with different projects from different universities came in the years to follow after his return. With the experience he accumulated, he was eventually able to establish the Biomedical Devices Innovation and eHealth Research Group by engaging with research in robotic rehabilitation and surgical instruments funded by the PCHRD. Some of the problems faced by the medical industry in the Philippines are the economic disparity in healthcare, lack of access to high-tech medical devices, and dependence on imported technologies. With these problems, we realized that there is a need to develop these devices. This is why the De La Salle University Institute of Biomedical Engineering and Health Technologies was proposed to bridge these gaps. Aside from these, IBET aims to also be able to address the following needs: common service facilities, a platform for exchange of information, and the need for more experts in the field of biomedical engineering. IBET plans to address this with a framework that includes capacity building of the biomedical engineering field in the Philippines, collaborations, lab-to-market roadmap, and one-stop shop for biomedical research. There are currently about 6 projects under IBET. The Agape project is a wearable robotic exoskeleton that aids the post-stroke or injured patient's upper limbs to perform a range of motion that eventually helps regain their motor control. The Lapara project is a laparoscopic instrument that will improve the maneuverability of a surgeon in the operating room by integrating joint articulation, robotic arm control, haptic and visual feedback, and an ergonomic workstation. The Tayo project is a robotic device for early trunk and lower limb rehabilitation that helps restore the patient's lower limb strength and range of motion. The DOE project aims to develop an impervious wearable wireless intravaginal monitoring sensor device designed to determine the optimal time for goat artificial insemination, and at the same time giving farmers the capability to monitor the overall estrus cycle of a goat. The Capacita project aims to be able to teach the skills and knowledge needed in the commercialization of biomedical engineering and health technologies to researchers, inventors, technology transfer officers, and related personnel. The Kandili project is a competitive intellectual property management system to be able to commercialize biomedical devices, hospital equipment, and health technologies through the IBET programs effectively and efficiently. Project Agapay, Lapara, Tayo, DOE, Capacita, and Kandili are the current projects being handled by IBET. As we continue to innovate the industry through our current projects, we will also be talking about our upcoming projects. The current status of DLSU IBET is that of a niche center in the region for research and development in medical robotics. From the categories of R&D, the Neurotech program will officially be the first program under the newly created DLSU IBET NICER program on medical robotics, which aims to focus on the last thrust, which is neurorobotics. With Dr. Roy Francis Navea as program leader, the Neurotech program will be multi- and interdisciplinary in nature and will establish 3 component projects: the Salle project, Ibalik project, and Sigla project. First project commenced under the Neurotech program is the Salle project, which is a wheelchair that operates on the user's brainwaves, meant for patients with physical disabilities such as autoimmune disease, motor neuron disease, spinal cord injuries, and more. Another IBET-approved project under the Neurotech program is the Ibalik project, a cognitive and motor function rehabilitation using neurofeedback training system for stroke patients. This came from the concept of Ibalik, which means to restore. The third project under the Neurotech program is the Sigla project. It is a neurofeedback therapy solution designed for people diagnosed with depression, and the idea came from the concept Ibalik ang Sigla, something desired for people with depression. IBET has several plans for its future, increasing the R&D collaborations for the biomedical devices innovation and health researches, IP protection for all research projects and commercializing IBET's developed devices, increasing the quality of publications and referred journals, establishing go-to centers for biomedical devices and hospital equipment, fundraising to construct a building to house the different research centers, transforming IBET into a university institute, and lastly, to spearhead the creation of the Philippine bioregions through the NICER program. What are Dr. Bugtay's thoughts, experiences, and realizations through his journey? Overall, he believes it was a deeply meaningful learning experience. He learned that making connections with other international researchers helps bear fruit to new and more innovative ideas. He realized that the original thought may have not been wrong, but there could be other ways to achieve your goal. Cost isn't everything. The important thing is what you bring to the table. What makes your product better than what's already being sold?